Hello, everyone. My name is Eric Walters. First time here. We are. Can you go next slide, please? So we are a company focusing on sterilization. Does anyone? Move a little further. Okay. Does anyone know what this is? This is called the duodenoscope, for short. I'm going to call it the D-scope. Thank you. What this does has an elevator mechanism. This particular device goes down your throat into the bile duct and pancreas, and has various tools that can cut, snip, move fluids between lumens. So I want a little voice of hands here. How many believe this scope, which can be used 3,000 or 4,000 times, is sterile? Please raise your hand. Oops. Please raise your hand if you believe this is sterile. Come on, there's got to be more hands than that. I'm up to 3 hands. Most groups I talk to, 95% of hands go up, believe it's sterile. So current processes that are used by endoscopy departments of hospitals go through a process called high-level disinfection, which means that this particular elevator mechanism, the lumens inside, have pathogens which become solidified inside and become biofilm. It's transferred from one patient to another. Now I can see by your reaction that I'm glad I'm talking to you after supper, because a lot of times it's a difficult discussion. Go next slide, please. So our particular process is not one that's similarly used in the hospitals. We use microwave to break protein bonds. We use non-toxic solvents, which you can buy at CVS. And we basically use the pulsating technology to break through biofilm and any pathogens that are remaining on these scopes. A more common scope, which many of you may have had a procedure, is called a colonoscope. And those are recycled up to 4,000 times. And while the end of it is square and it doesn't have the elevator mechanism, they have the same issues of they're only high-level disinfected, not sterilized. Next slide, please. So we have really 2 technologies. We have the microwave device, put this down, the microwave device, which is used to sterilize, but we've also come up developing another technology which will tell for each scope that's used exactly which pathogen survived. If you ask a hospital administrator now if there are any pathogens left in that scope, and if he says maybe, because it's high-level disinfected, not sterilized, okay, which ones? They can't tell you. So we're developing a test, and we filed a patent with very little prior art, which will tell you names you well know, C. diff, MRSA, CRE, any family of pathogen will tell you specifically what survived and what hasn't. So we believe there's a huge market opportunity. If you look at the number of procedures annually, just in the US alone, and this doesn't include the rest of the world, 15 million colonoscopies, 500,000 duodenoscope procedures. And it's a fairly high growth rate between 6 and 10%. Patients suffer from hospital-acquired infections and go into intensive care, which is very expensive for hospitals. And I like to kid around that Perry Mason the fourth and Perry Mason the fifth, the lawyers love to sue these companies. Olympus just was sued $8 million for an infected scope about a year and a half ago, and well, the lawsuit's coming. So we have a very small company of a team, John Erickson. We are developing ways to determine what's called proteolysis. Proteolysis is the basis of destroying links and bonds and proteins. That's what microwave does. And we're very close to filing accelerated pathway with the FDA. It's called, for those who don't know, it's a 510K process. And what that will do, we believe, is put us on a fast track for a product clearance sometime in 2019. Again, our technology is not a copy of what's there now. It's a totally different technology from what's used just for high-level disinfection currently. Next slide. So we've demonstrated sterilization of lumens in the elevator mechanism. We're not aware of any process that can do that now. And we have engaged with, there's 3 major scope companies, Olympus, Fuji, Pentax. There are reprocessors, and there are companies that want to get in the market, names you know very well. We've already talked to 3M, Medtronic, Boston Scientific, Getinga, Steris. So we believe once we get a more definitive clearance pathway with the FDA, we'll finish up some durability testing in the next several weeks. We'll be on a pathway to raising money principally from these large strategic companies. You done? I'm done. Thank you. Sure.
Anybody have any questions? Actually, should we spread that out?
No.
Here, give me one else. I don't really want to touch it, but
It's sterile.
I assume with your process it is.
No.
So, lovely. Because you need the social media photo, right? You're going to question it in the back?
Yes. Hello.
Don't want to know.
Our unit, we don't have final product design, but it'll probably be somewhere between $40,000 and $50,000, somewhere in that range. Yes, sir.
In the case of testing that you mentioned about, like what's the mechanism? Do you check, they elaborate the testing of the end result, saying that this is sterilized, that you mentioned in the slide.
So the process uses antibodies and custom proteins to determine on a family or genera basis, and they're all different, which particular pathogens survive the process. C. diff is a different family than CRE, than MRSA. They all have different characteristics, they all have different protein relationships. Our goal is to determine what those are and to place a strip similar to what's used in autoclaves now, or an automatic endoscopy process, which puts fluid through these to basically determine whether or not any of these pathogens survive. As I said before, it's a great mystery. Hospitals do not know what's in here, unfortunately, and we want to change that. Thank you.